We hope you don't have cancer, but if you do, this show's for you. The Stupid Cancer Show!
Hey guys, we're back here on the Stupid Cancer Show. I'm Matthew Zachary, the founder of Stupid Cancer. Joining me here is Ann Scalia, a fertility nurse and a cancer survivor herself. You are the manager of clinical education specialists at AllianceRx Walgreens Prime. Today's show is all about fertility, reproductive rights, and young adult cancer. Welcome to the show.
Thanks, Matt.
Oh, by the way, we'll put a link to all of Ann's awesomeness in the description to this video, but you and I go back 10 years.
Yes.
So she's good people, says me. No, really, you are good people.
Thank you.
This is your first time on the show.
It is.
But not Walgreens specifically first time on our show. We've done lots of Walgreens shows. You could search YouTube in the archives. We've done a lot of amazing shows with Walgreens, and we're very deeply appreciative of them sponsoring this broadcast with AllianceRx Walgreens Prime. All that fabulousness said, welcome
Thank you
to the show.
I'm happy to be here.
Yes, as we are as cancer survivors, happy to be here every day.
Yes.
Yes. So yeah, we're here to talk about fertility, preservation, fertility, I call them rights, but really liberties and how you kind of deserve to know what your choices are when infertility is sort of on the table when you get diagnosed with cancer. Can you talk about your experience in that field, and has being a survivor yourself impacted your perspective on how you work in this system?
Well, my cancer diagnosis, obviously, fertility preservation didn't come into effect for me. However, I feel that being a cancer survivor, I can relate to that obviously diagnosis and population, and all of my experience with fertility, being a fertility nurse for over 35 years, and then talking about fertility preservation, you know, that's an extra stressor for patients.
Right. I mean, we talked before the show about how this is a good problem to have with perspective, that cancer used to just be a death sentence, and now we have the opportunity to live life on our terms to our fullest, and here is a way to add that level of value and quality to what we hope is becoming a long-term survivor.
Yes.
So what is specifically your role at AllianceRx Walgreens Prime?
So I'm a manager of the clinical education specialist team, fertility, at AllianceRx Walgreens Prime. And so we have a lot of programs that we create for patient support, not just for patients that are going through fertility, but also oncology patients that are looking for fertility preservation options.
So in terms of the the challenges related to addressing this issue, there are something like 80,000 Americans diagnosed with cancer every year in their fertile years, not just young adults,
Yes.
even teenagers and 40-somethings out there. What is your role in that process? We talk about access and cost of care. You know, you're intervening in a great way.
Well, so as you know, I mean, over the years, oncologists are doing a great job. You know, there's over 600,000 women just alone of reproductive age that are survivors. And, you know, patients are, you know, when they're going through their cancer treatment, you know, they want their life back.
Right.
And fertility is a huge quality of life issue. And oftentimes when they get that first cancer diagnosis, it's not often discussed because, again, obviously the first thing that you have to think about is
Save my life.
Save my life.
Right. Is there a value to the at what cost conversation these days? Should women be entitled to know that they are at risk for infertility at point of care?
Well, not just women, really.
Well, men too. I mean,
really,
I'm a byproduct of fertility preservation success story.
Well, so really the definition of fertility preservation is anytime reproductive potential is threatened.
Right.
And so really now ASCO guidelines mandate that a conversation needs to be had.
Right.
However, you know, it's a complete field of specialty.
Right.
And so that's where, patients really need to have that conversation and advocate for themselves. And really, any patient that's of reproductive age, that question should be asked.
Right.
And I know the focus is on, saving someone's life, but again, it's a quality of life issue for patients, and this often drives them through cancer treatment.
Well, that's another thing. We have amazing case studies over the years here at Stupid Cancer with women who were given the option and now have, I would say, a more, successful, higher quality of life perspective. They have a child, and there were women who were not given those options and then are now barren and biologically impossible to have children. Surrogacy and adoption are obviously a narrative here, but in terms of, again, like your conversations with nurses, have you found it to be just an unknown, or is this an obvious thing that you're discovering? Like, of course we should have this conversation.
Well, over the years, there's been a greater awareness. ASCO, the American Society for Clinical Oncology, came out with guidelines in 2006.
Right.
Kind of trying to get the awareness out there that the conversations start at the point of diagnosis and just ask the question, are you interested or are you aware? And then let the patients make their decision.
Right.
Because they just want the choice. And there are a lot of fertility preservation options available for women, men, and children. Some of those are experimental. And again, they just want to be able to make the choice.
So let's talk about what AllianceRx Walgreens Prime does.
Okay, so AllianceRx Walgreens Prime is, in 2017, we were formed. It's Walgreens and a collaboration with Prime Therapeutics, and we are one of the largest specialty pharmacies. And we also, obviously fill oncology drugs,
Right.
but we also do a lot in fertility. And so we have a team, a dedicated fertility team of pharmacists, nurses, patient care coordinators, and so we put together a lot of patient programs. We have a fertility team that will process, say, if a patient is going through a fertility preservation cycle. Obviously, time is of the essence. You're never going to put off a patient's treatment,
Well, that is clearly something that has been an issue that people are facing. Like, how much time do I, if I have is it 8 weeks? Is it 3 months? Like, of course, you have to go through a whole process to start just getting follicles out there. Do you want to delay treatment to do that?
Right, and usually a reproductive endocrinologist will see a patient within 24 to 48 hours and do a consult, and they collaborate with the oncology community. At AllianceRx Walgreens Prime, we have a fertility team dedicated, and so within 24 to 48 hours, we will get that medication out. The other piece is, though, we have a lot of patient assistance programs because one big concern for patients is cost. How can I afford this? Because even in states where fertility coverage is mandated, it's not covered because a patient with cancer doesn't meet the traditional diagnosis
Right.
of infertility.
Mm-hmm.
This is a result of their potential treatment. So the conversation should be had that potentially your fertility could be affected. Here are the options that you can talk about. So as far as us, when we get a prescription, we have a lot of patient assistance programs. Specifically, we have a program called the Heartbeat Program. It's a collaboration with Ferring Pharmaceuticals through a donation of medications from them. And so basically that offsets the cost of medication, which could be anywhere from $3,000 to $5,000 for a patient. And so if a patient was trying to think about considering, egg freezing or embryo freezing, that's a big cost. And so that's a savings for them that they can get that medication for free. We also have other, cost-saving medication programs. We work with ReuniteRx Oncofertility preservation program where the patients can apply for that. But that's all done within 24 to 48 hours, knowing that the patient has to start her treatment right away.
So how is this found? Where in the communities does this conversation happen? How are newly diagnosed patients in their fertile years made aware that here is something for you? And again, and to follow that up, it's not just about preserving fertility. These could be people in their early 20s that parenthood is not even remotely on their mind at that time.
Well, as a fertility nurse, we interact a lot. We do a lot of collaborating with oncology nurses and the Oncology Nurses Society. We do a lot of fertility preservation education programs for the nurses, and they are just hungry for the knowledge. And we also have on walgreens.com/fertility a patient website. So we have available resources, Stupid Cancer.
I know that group.
Look for that. There is the Alliance for Fertility Preservation that's right here in New York City that does a lot of work. The Oncofertility Consortium has a lot of resources for patients. They can help, all these places can help direct patients to find information about fertility preservation. And the Live Strong Foundation is another foundation that has a lot of resources. So if you go to our website, we have a lot of information there to direct. We have a lot of information about the financial assistance programs on there. And then one other thing we do is when these patients are going through their actual fertility preservation treatment, they have additional needs because for them it's not only do they have the oncology diagnosis to worry about, now all of a sudden they have to do fertility preservation treatment and learn that education in meds.
Right.
So we have a team of nurses that will call patients and help them before they start their medications. And they'll go over all the medications, how to administer them, how to store them. And we also offer video consulting through a HIPAA-compliant program where if patients want to see their fertility nurse in the privacy of their own home, they can schedule it with us and we'll go over everything with them.
That's amazing. That is amazing.
And, it's really a support for them. And, we actually recently had a patient that did go through fertility preservation options and actually kept the number of the nurse that did the fertility order review call with her, and she called to let this nurse know that she was 8 weeks pregnant. Now, to me, that's amazing support.
We like good and happy stories. I look back, 13, 14 years ago when the young adult cancer movement was just getting started and fertility was one of the core quality of life. We call them like the civil liberty to know your parenthood potential options out there. And it just wasn't even a thing, ASCO, oncology. I mean, it just seemed so obvious that when you're diagnosed with cancer in your fertile years, your treatment might present risk because you're filling your body up with all sorts of fun stuff out there. This is real progress. This is a really, really big deal. How many patients would you say you guys work with on an average basis?
Well, for example, the Heartbeat program started in 2014. And as of last month, we've helped over 6,000 patients.
Wow.
And distributed or dispensed over $42 million worth of medication.
That's a lot of diapers.
Hopefully.
A lot of diapers.
Hopefully.
I mean, that's the name of the game, is giving people dignity, quality of life, and opportunity where hopefully your diagnosis is just kind of I'll say this lovingly, a speed bump.
Well,
Really.
It's important. And, fertility preservation is a passion for us, getting the education out there. And, really we want to support it in any way we can.
I mean, I feel like the whole world should know about the Heartbeat program and what can organizations like ours, what can the sort of the young adult cancer community do? Where can we go? Well, I mean, walgreens.com/fertility, but I feel like we can be a huge voice to make everyone aware that they have the opportunity to have that family planning conversation.
You said it right there, because really the key message that I want to get out today is that, again, fertility preservation options are available before, during, and after cancer. And really, I just want to get the message out there to advocate for yourself and make sure that you bring up the questions about your fertility potential. Will it be affected? And your physician can give you resources or just let them know that that's a need you have. So again, really, patient advocating for themselves.
And this is real progress. This is something we could sit back and be very proud of. And yes, there's still more work to be done, but now we are looking at real things happening in the real world that just didn't happen a decade ago.
Right, and you can remember when I gave a presentation at Oh My God, Stupid Cancer years ago. We
Right.
did a fertility preservation panel, and this was quite a number of years ago.
Yes.
And
I might have had a little more hair, not much.
yeah, but I mean, basically, 3/4 of the room did not know about options when they had their treatment, and now at later days, it's much better.
And that's been the pay it forward model of the young adult cancer. We want to make sure that no one has to go through the same level of crap that we went through. And if that does include making someone else aware that this could happen to you, we want more babies in this world. Said me, no, I have 2 and that's enough. But most people, we love just the fact that this is something in the real world for this community.
Yes, quality of life.
Yep. So 10 years later, here we are.
Here
Look at
we
that.
are.
Lots of progress. Ann Scalia is the manager of clinical education specialty at AllianceRx Walgreens Prime. Again, we love these shows. These are great shows. We hope you enjoyed this episode. Special thanks again to Walgreens and the AllianceRx Walgreens Prime folks for sponsoring the show, making this possible. And we'll see you back here next time on the Stupid Cancer Show. Take care, folks. Bye-bye.
Bye.
Hey friends, thank you again for watching our show. Please subscribe to our channel, click that bell to be notified, and remember, the Stupid Cancer Show is brought to you by Stupid Cancer. We make young adult cancer suck less. Online 24/7 at stupidcancer.org.